the last few months have, I think, shown the value of technology, digital technology in healthcare, and given a massive boost to the digital transformation agenda across the NHS in the UK. And I'll pick out a few areas where technology has made a big difference. Not necessarily very advanced technology. In some cases, technology which has been well used in other sectors for some time, but not used in healthcare. So one is remote consultations. We moved very quickly when the pandemic hit to move the vast majority of appointments, both at primary and secondary, to a remote basis, either on the phone or online. And that's been extremely effective and very fast. Primary care, 99% of general practice surgeries now have the ability to do online consultations, and a significant majority of consultations are remote, whether that's telephone or video. Now, I suspect that after the pandemic, there'll be some balancing. We won't necessarily stick where we are. We won't go back to where we were before. We'll find a medium between the two. But the key thing is now the principle that actually care can be delivered remotely in a lot of cases and for a lot of patients has been established and will be more easily accepted both on the clinician side and also on the citizen side. So that would be number one. I think number two would be the use of data, where we realized that to manage the crisis effectively, we would need to have really good aggregated anonymous data for managers at national, regional and local level. So we set up the NHS data store with all sorts of protections in place, and it put the management of the pandemic on a totally different basis. And then the third area is it's given us a real push, both because of the necessity of the moment, but also because of some of the emergency regulations that came with the pandemic, to sharing patient data. So we've been able to get patient data flowing more, safely, but more effectively around the system so that clinicians can more easily access the information they need about the patients in front of them. And I think between those three things, I think a big difference has been made.
You mentioned use of data. Now, how is data used in order to promote better care during the pandemic? Can you give us an example?
So I'll give you a couple of examples. At national level, we were able to track quite effectively capacity against demand across the system. So we knew where there were spare beds and what sort of beds, whether they were ventilated beds or whatever. We knew where there was a requirement or shortages of different sorts of supplies. And so we were able more effectively than we would have been without this quality of data to manage the flow of supplies to where they were most needed. In terms of individual patients, with the agreement of our various sort of medical associations, the British Medical Association, the Royal College of GPs, we added more data about patients to what we call the summary care record, which means that if you were a paramedic meeting someone for the first time, or somebody presented at hospital who you didn't know, you could look at more pertinent details about their clinical history than you would have been able to otherwise. And we know that this has saved lives.
That's very significant. Would you say that AI, artificial intelligence, with all the hype, has actually delivered its promise up until now?
I think it has in certain respects. So in terms of extracting insight and understanding from huge quantities of data, we've seen, real progress made on our understanding of the data on how the virus affects different groups of people, different cohorts, through the use of AI and sort of advanced data techniques. I think where it hasn't yet had the impact that it might have done has been as an intermediary between the clinician and the citizen. But I think that's probably a function of the stage of our understanding of the virus. And as that understanding grows, the ability of AI to provide a sort of smart triage tool, I think, will grow as well. So its moment for that may come as well.
There's a claim, Matthew, that COVID-19 was an exceedingly effective accelerator of digital health adoption, maybe the most effective one ever. And you've mentioned some aspects of this earlier on when you talked about the adoption of online care and alluded to some of the symptom checkers. Could you tell us a little bit more about your experience in the UK and which digital health transformation aspects were accelerated during COVID-19? And what actually changed that allowed it? Was it regulation that changed? Was it acceptance by the physicians and by the unions that changed? Or maybe it was acceptance by the patients or just bare necessity?
One of the things we did early in the crisis that I think made a massive difference was we produced a really simple one-page guide to information governance for people working in health and care, saying essentially, if you are in good faith, trying to look after your patients and acting in sensible ways, then you're not going to get into trouble. And that was endorsed by our information commissioner, by the National Data Guardian, and it had a really positive effect because it sent a signal, look, just be sensible, do the right thing, don't get yourself caught up in knots over sort of the massive detail of law, but just get on with it. And that was extremely positive. And we need to capture that can-do spirit and sort of bottle it and keep it for the future.
That's really a beautiful way to end this interview, Matthew. It was brilliant as always. This was very enlightening and very helpful. I think there are many, many new ideas here that others can use and emulate. I know how busy you are these days, and I want to thank you again for taking the time and spending it with us all. I'm sure that many people will benefit from it, so thank you.
Thanks, Ran. It's great to see you, and I'm sure you're one of the few people who's busier than I am.